How often, sitting at a computer monitor or in a comfortable chair in front of a TV screen, a person is worried about dry eyes and watery eyes. Unfortunately, this is not immediately pay attention. The patient goes to the ophthalmologist already in advanced cases, when there are problems with vision. Life situations are different, and no matter how they are resolved, we still cry, some from pain, some from resentment, and some from joy. When that moment comes, the tears separate effortlessly. However, their purpose is not only to express emotions. The function of the tear is to moisturize the cornea, which is especially sensitive in low humidity and hot weather. If this does not happen regularly, it may become cloudy. The tear evenly covers the cornea, causing a film to form on its surface, protecting the organs of vision from damaging environmental factors. Production of tears occurs in the lacrimal gland, located in the upper part of the orbit, and it is separated through the nasal duct at the inner corner of the eye. When people cry, some of the tear fluid may end up in the nasal cavity, often in children. Because of this, they lay the nose and have to blow their nose. Due to various reasons, the body fails, as a result of which the secretion of lacrimal fluid can be disrupted. This happens in large industrial centers and in adverse weather conditions, dry, hot weather. Most of all appeals to the oculist were recorded in the summer of 2010, when peat bogs burned in the Moscow region. Smog dried the cornea and revealed prone to insufficient tear production. At any time of the year, dry eye syndrome affects office clerks who spend all day at the computer. They periodically complain of dryness, redness in the eyes. Later, you may receive watery eyes. This is usually addressed to the ophthalmologist. First, the doctor needs to diagnose the syndrome. For this purpose, there is an indicator strip. It is placed behind the lower eyelid and wait until it is soaked with a tear. Usually it takes no more than 3 minutes, after which the strip becomes lilac. The severity of the pathology is determined by the length of the staining area. If it is less than 1.5 centimeters, then the patient has insufficient production of tears. Treatment of this pathology is symptomatic. First of all, you need to limit the time spent behind the monitor. Periodically to do breaks in work, least 15 minutes. If this measure is ineffective, apply the drug artificial tear. These drops are used as needed and create an artificial film on the cornea. The drug is sold in the public domain and does not require a prescription. Based on complaints, the patient can prescribe it himself. Drops are completely harmless, but as of today this is the only tool that can help the patient with this pathology.